There is no specific treatment for dengue. According to the WHO, the focus is on treating pain symptoms, and most cases of dengue fever can be treated at home with pain medicine. Every year, during the monsoon season, India witnesses a spike in vector-borne diseases like dengue, which occurs due to the bite of an Aedes mosquito. Dengue cases often peak between July and November every year. Earlier this month, the Health Ministry informed the Parliament that till June this year, the country recorded 32,091 dengue cases, 75% higher than the 18,391 cases recorded in the first 6 months in 2023. In a statement, Union Health Secretary Apoorva Chandra said that till the month of July, India had seen 50% more cases than the corresponding period last year, as reported by the print. Although dengue cases generally peak in October after the monsoon, this year's trend shows that, as of 31st of July, 2024, the number of cases is already almost 50% higher than at the same time last year, Chandra said. According to the ministry, the highest number of dengue cases, which can be fatal in severe cases, has been in Kerala, Karnataka, Maharashtra, Tamil Nadu, and Andhra Pradesh. The World Health Organization (WHO) estimated that about half of the world's population is now at risk of dengue, with an estimated 100 to 400 million infections occurring each year. In 2020, the country saw 44,585 dengue cases, which grew to 193,245 in 2021. In 2022, a total of 233,251 dengue cases were registered in various states, and the next year, it further increased to 289,235, the print reported. Over these years, the country has also registered a significant number of mortalities. In 2020, 56 lives were lost to dengue, and in 2021, this number increased to 346. In 2022, 303 dengue patients succumbed to the illness, while 385 died in 2023. Till June this year, 32 deaths have been reported. Are home remedies effective for treating dengue? There is no specific treatment for dengue. According to the WHO, the focus is on treating pain symptoms, and most cases of dengue fever can be treated at home with pain medicine. However, people often opt for home remedies believing that they can treat dengue. Goat's milk, papaya leaf, aloe vera, and uncooked turmeric are some of the popular home remedies people use to treat dengue. However, patients aren't aware of the consequences that can occur due to these remedies. Home remedies like papaya leaves, goat milk, and Giloy are often consumed for treating dengue, but there are no scientifically backed studies to prove it, and yes, they can be harmful. While Giloy is known to be useful in traditional medicine to boost immunity, its effect on dengue has not been studied or proved by medical experts. Overuse or improper use of Giloy can even lead to liver toxicity and other complications. Goat milk might be beneficial for your overall health, but its use in treating dengue has not been confirmed by any study. Dr. Tushar Tyal, lead consultant, Department of Internal Medicine, CK Birla Hospital, Gurugram, told FinancialExpress.com. Dr. Tyal also informed that these natural products may even cause allergic reactions in some individuals, leading to symptoms like rashes or itching in some cases. Some home remedies, especially the consumption of papaya leaves, may cause nausea, vomiting, and upset your stomach. So, these home remedies that are not backed by medical experts can worsen the condition of a dengue patient, who may already be dealing with dehydration and weakness, he added. Dr. Pankaj Soni, Principal Director, Internal Medicine, Fortis Escorts, Okhla Road, New Delhi, explained that dengue is a viral disease and there are a lot of things that happen in the body of a patient infected with dengue virus. During the first 4 or 5 days, it is a state where the patient observes symptoms like nausea, vomiting, high-grade fever and dehydration. And in the second stage, the platelet count goes down and then the body starts to accumulate a lot of fluid. So, if we talk about the papaya leaves, it can cause further aggravation of nausea, vomiting, and they are irritant to the stomach as well as the esophagus, so they can make the symptoms worse. Similarly, if you look at Giloy, it also has nausea associated with it and can also lead to constipation, Dr. Soni told FinancialExpress.com. There are a lot of gastric symptoms that the patient is already in trouble with due to dengue, and these remedies might contribute in making the symptoms worse, he informed. If we talk about goat milk, people use it to improve the platelet count. Goat milk is a known allergen to the human body. Secondly, if goat milk is taken in unpasteurized form, it can also lead to food poisoning, he explained. Dr. Soni also said that there have been no clinical trials till date to authenticate that any of these, whether they are papaya leaves, goat milk or Giloy, have any positive impact on the platelet count, or any other parameter in a dengue patient, so neither of these should be consumed. What to do if get dengue? According to WHO, if you get dengue, it's important to rest, drink plenty of liquids, use acetaminophen, paracetamol for pain, avoid non-steroidal anti-inflammatory drugs, like ibuprofen and aspirin, and watch for severe symptoms and contact your doctor as soon as possible if you notice any.